In the mid-1800s, Fort Vancouver was a rough military outpost full of outlaws and renegades. Then along came a French-Canadian nun by the name of Mother Joseph, who would have a profound impact on Vancouver and the Pacific Northwest.
Mother Joseph was born Esther Pariseau in Montreal. She was French-speaking. She influenced this community unbelievably. And her drive was to care for the ill, the infirm, the helpless.
With the help of her fellow Sisters of Charity, Mother Joseph designed and built the first permanent hospital in the Pacific Northwest. Patients were charged the handsome sum of $1 a day.
And from that grew St. Joseph's Hospital, and grew on today to Southwest Washington Medical Center with 2 campuses. All of that began from a tiny log cabin almost hospital that Mother Joseph built.
In 1876, the old St. James Lunatic Asylum was transformed into the new St. Joseph. But a fire destroyed the building in 1878, so Mother Joseph set out on a begging tour to raise money to rebuild.
And she thought, we'll go where the money is, and no one's going to give money to an ugly old woman like me, so I will take a young, pretty nun with me, and I will give the speech, and she will go out among them with the hat and collect the gold.
With the gold came more growth for St. Joseph. Over the years, the buildings grew larger and more impressive. But in the 1960s, the money began to run dry, and the sisters announced that they were going to close St. Joseph.
A bunch of doctors came to me and said, why don't we try to replace the hospital that the sisters said they were closing?
So the St. Joseph Community Hospital Association was formed, and a grassroots fundraising drive emerged, spearheaded by the hospital's Ladies Auxiliary.
Ultimately, we had 1,500 women who called themselves Mother Joseph Miracle Workers, and they went door to door. One of the things they did was to auction off a calf. I don't know how much money that brought in, but it gave us a little notoriety.
By the time it was over, the steer had netted the hospital $1,400, the campaign over $1 million, enough to receive federal matching funds to keep St. Joseph afloat. And in 1967, the sisters handed over the keys. A new hospital was built off of Mill Plain Boulevard. With the help of the U.S. Army, patients were transferred to the facility in the spring of 1972. Several years later, there were talks of a merger between Vancouver Memorial Hospital and St. Joseph.
All the docs in town were accredited at both institutions. And it just seemed at the time there would be some cost savings. And thus they did merge.
The combined institutions were named Southwest Washington Hospitals. They consolidated further in 1989 under the name Southwest Washington Medical Center, coinciding with the groundbreaking for a larger building on Mill Plain. Southwest was beginning to flex its muscles.
The medical center grew, and it was an extraordinarily good hospital and absolutely up to date, and was able to compete really with any of the Portland hospitals.
Clark County has experienced explosive growth since the early 1990s, and Southwest has kept pace, expanding medical services and installing cutting-edge technologies.
This definitely is a state-of-the-art facility. The equipment that we have available right now provides maximal quality of images. The patient comfort is also extremely important to us.
Everyone in Clark County can feel very confident that this is an extraordinary medical center that does a very exceptional job, and we've been recognized nationally for that job.
The opening of the Furstenberg Patient Tower in 2007 continues Southwest's commitment to providing outstanding health care to the people of Clark County.
The Furstenberg Tower is beautiful. I'm always excited when operating on a patient and they get sent up here. It's got great views.
I think we're very fortunate that we have a not-for-profit hospital that is really dedicated to serving the people in this community. And from a long history, from the beginnings with Mother Joseph, they've carried on that history of being leaders and being on the cutting edge, really. One of the 100 top hospitals in the country. And it's something that I think we kind of take for granted.
Mother Joseph passed away in 1902 and was laid to rest in a modest grave alongside her fellow sisters.
And her last words were, "Remember, sisters, whatever we do for the poor." And I think that's their legacy, and it's our legacy, and it's Southwest Washington's as well.
Southwest Washington Medical Center, pioneering medicine for 150 years and counting.